Introducing the new EndoClot Polysaccharide Hemostatic System, EndoClot PHS. EndoClot PHS is an advanced powder hemostat that is applied during a procedure using consistent air pressure, which is intended to provide more control of delivery. It is indicated for use in combination with other conventional techniques, such as clips, for large and diffuse bleeds, like those occurring in peptic ulcers, post-biopsy, polypectomy, tumor bleeding, post-EMR and ESD. The EndoClot PHS system consists of a powder delivery system and absorbable modified polymers, AMP. The following instructions do not eliminate the necessity of formal training for the use of EndoClot PHS. The techniques and procedures described here do not represent all clinical acceptable protocols, nor are they intended as a substitute for a physician's experience and judgment in treating specific surgical conditions. This product is compatible with any commercially available gastroscopes and colonoscopes having a working channel with an inner diameter no less than 2.8 millimeters. Inspect and open the package by peeling off the cover. Press on/off button to switch on/off the air compressor to ensure constant airflow to prevent reflux. Connect the applicator to an EndoClot air compressor with constant gas flow. Screw the AMP particle bellow onto the applicator in the off position. Keep the applicator always in an upright position. Make sure the gas is flowing to prevent fluid from reversing into catheter. Then insert the catheter through a working channel on the endoscope and position the endoscope to the bleeding site. Avoid bending the catheter when inserting into the working channel. Hold the bellow in an upright position to avoid spillage when inserting the catheter into the endoscope. Avoid direct contact of the catheter tip with any fluids and/or mucosa. To avoid occlusion, please keep the catheter tip 1 to 2 centimeters away from the lesion at all times. Gently tilt the bellow to deliver the powder to the site of bleeding via the applicator. Spray a liberal amount of AMP particles on the wound. If bleeding continues, irrigate excess AMP particles with a saline solution, then reapply. Once hemostasis is achieved, remove excess AMP particles with irrigation. Withdraw the applicator from the endoscope after hemostasis is achieved.